I'm Reda Sadki. I lead the Geneva Learning Foundation. I'm going to explain some of and explore with you this idea of community in the model of the Geneva Learning Foundation, which is a model for how to drive change, to tackle critical threats to our societies. And it's really our mission to research, develop, and implement new ways to lead change. Now, we build on recent advances in a number of sciences around networks, distributed knowledge, where and how learning happens, peer learning, and then this idea in the world of knowledge abundance that knowledge is increasingly fragmented. Now, here is why you should care. And these are the key capabilities. Imagine that whatever the challenge is, think about the challenge that you're tackling. And if I told you that in 3 days, we could build a community, within weeks, we could have massive reach thousands of people with a shared interest or purpose that you are specifically interested in. Within 2 weeks, we could deliver large volume of high quality data and insights. Are these things that would be of value to you? If they are, stay tuned, keep listening, because that's not all. Number 4 is identifying emergent leaders, and that also happens in the 2-week process. Within months, we get to outcomes with attribution to the model, to the interventions that we put in place. And these are self-sustaining, growing communities that become less and less dependent on anything that we do and sustain themselves. There's no upper limit, so scale. And then participants can work in their own languages, in their own context. It's all about context, in fact. And we have achieved the same outcomes. So the leadership, the high quality data and insights, the outcomes, the self-sustaining growth, and then no upper limit in every context and discipline where we've tried this. Last, and this is number 10, others can learn to use it. And we also see that happen within 2 weeks. So if that's of interest to you, then you should be interested in this presentation. Now, our business model at the Geneva Learning Foundation is very simple. We combine insights, events, and partnerships. And we see an outsized return on investment. You can see some of the range of figures is 4 to 12 Swiss francs invested by participants for every 1 franc invested. This is a key aspect to education where people are investing in themselves. Now, what does that actually mean? We do something called Teach to Reach. We just celebrated the 10th edition, and this is not the 10th anniversary. We have 2 to 4 of these each year. And we focused on health workers sharing experience. Now, this was the 10th edition. In the first 1, 2, 3, 4, 5, 6, 7 editions, we saw ascendant participation. And these were health workers sharing experience before, during, and after each event in all kinds of remarkable ways. We went from 2,604 participants to 16,835 by June 2023. And by October 2023, we were up to 18,000 and now 21,000 with the latest Teach to Reach 10. So who is participating? Well, these are health workers on the front lines in a specific context for this health program. But it could easily be the hardest to reach, most important, most valuable people who make the biggest difference with your challenge. So with health, that means people who work in health facilities and districts, health work for government, and health for civil society organizations, health for francophones, and then you can see 1 in 5 work in armed conflict. There are other stats showing really we are reaching people with deep experience who are on the front lines. Now, the connections we built, this is social networking analysis, is not about the connections they have with the Geneva Learning Foundation. It's actually about the connections that they have with each other. And so we want to go back and take you to how the sort of line of progression, and you'll see some of the running threads. We started in 2016, where with the ICRC, Norwegian Red Cross, and the International Federation of Red Crescent Societies, we don't have all the logos up, but we reached 5,000 pre-hospital emergency workers, so ambulance personnel. We built in less than 6 months. We saw the deep bonds of trust form within just 4 weeks. And then working together, this group produced detailed peer-reviewed case studies of violence or the threat of violence against health workers in just 4 weeks. So this was really a demonstration of this network theory of our model in action. Now, here's the testimonial that is key. With digital learning, most people think it's about transmitting information. What we saw is that for Christina, who leads a helicopter rescue team in Cadiz, Spain, she says that she became mindful in new ways. Think about that, mindfulness. That's a very high order learning objective to attain, and she did it purely by digital network means. Now then, with the World Health Organization, we built what we call the WHO Immunization Scholar Program. And Within 3 years, we had a network of 15,000 practitioners across 90 countries. Half of each cohort's typically around 400 people, volunteered to support the next one. And participants, we discovered in January 2019, were actually implementing their course projects without asking us for permission. And so we thought, well, what would happen if we were more intentional about helping people take their course projects focused on their own context and reconciled with using WHO's best available knowledge to figure out what to do and how to do it? Could we unite alumni in a shared pledge to turn knowledge into action? So by January 2020, we were able to look at what difference this model would make of peers supporting each other, not just to learn, but to actually implement. At the bottom, you see the control group, and you can see that almost everyone in the control group, they also had an intent to do something, but almost none of them did anything. By contrast, those using the TGLF model, you can see here, had significant implementation, and this is in just 6 months. Typically, people said that it would take 12 to 18 months to fully implement a project, so this is sort of a third of the way in, and you can already see that some participants, that's the dark green line, have implemented and documented their results. Karen Watkins and colleagues then studied this and described how participants realize how they can combine different types of learning to actually drive progress, not only to learn, but also to implement. This is when we formulated then this sort of continuum of action from knowledge acquisition to idea generation, action planning, implementation, continuous improvement and revision, all the way to the point where you're documenting impact. Then came 2020. And so with support from the Gates Foundation, we had 600 alumni who met on a weekly basis every Monday starting in March 2020. And what happened then is that they created the COVID-19 Peer Hub, and that connected 6,000, so 10x the number of health workers. In 10 days, they had shared over 1,200 local solutions, and within 3 months, at a time when there were no guidelines for recovery, almost a third, had implemented recovery plans. Now, in 2022, 2 years later, we launched the Movement for Immunization Agenda 2030. And this is pulling together everything that we had learned up to that point with support from the Wellcome Trust, and 6,185 immunization staff from 99 countries came in less than 2 weeks and answered 99 questions in a detailed questionnaire in order to join. And together, over the course between March and June, they generated over 500,000 data points on local immunization challenges and solutions. Just imagine. And together, this group of initially 6,000 people grew to encompass 16,000 by the month of June, and then again went into this process where you can see here the progression. So at the top left is the launch, and that was on March 7th, 2022. And then you can see over very short spans of time, the activities, crowdsourcing ideas, doing situation analysis, action planning, and then actual implementing while challenging each other to do better, reporting, sharing lessons learned, successes, and challenges. And you can see the whole idea at the bottom, this green arrow of giving back to practitioners. Everything that people shared, our insights team analyzed to help with a sense-making, with a meaning-making, and shared back living documents that everyone could contribute to, and organize these dynamic learning events, of which Teach to Reach Connect, Teach to Reach has become the flagship. And you saw the growth curve for that. What we learned after the first year was we did not find any magic bullets, but we did see an opportunity for transformation. By driving improvement from the ground up, by using peer learning and linking to the best available global knowledge, by harnessing knowledge, experience, intrinsic motivation. Now, with this platform, network, and community infrastructure in place, we could suddenly begin to do things with a lot less effort. The economy of effort changed to do things such as to find the leaders who are doing exceptional work, using what they learned, through this Movement for Immunization Agenda 2030 and turning that into action and results, documenting that, and then sharing that across the network. Now, for the last 3 years, we've held a World Immunization Week celebration. The last one on 8th of May 2024 had over 8,000 people registered to attend. 8,000 immunization staff, as well as country and international partners to share experience. And what that turns into, for the last 3 years, each year, immunization staff have shared over 1,000 photos, documenting their own daily work, telling their own stories. We've worked with our fellow photography, Christa Bode, to help them get better at telling their own visual stories. And you can see 2 of the collections from 2022 and 2023 that we have published, again, give back to the community. For the 50th anniversary of the expanded program on immunization, we held at Teach to Reach a plenary session with, again, thousands in attendance. And this is probably the world's biggest celebration of the 50 years of EPI, a program that has saved 154 million lives, according to the latest estimates. So our focus became immunization. But this does not prevent us from exploring other disease areas. So with Bridges development, with the End Fund, with also Canadian Grand Challenges and Bruyère and other partners, Bridges to Development asked us if we could bring this model to the neglected tropical diseases community. So 56 women and girls are affected in Africa by female genital schistosomiasis. What we saw was over 5,000 health professionals joined in 2 weeks. And then we saw throughout the African continent, over 300 practitioners began to develop, and some began to implement local projects using local resources. This has led to extending the partnership around NTDs to new partners, such as Uniting to Combat Neglected Tropical Diseases, featured at Teach to Reach 10, where we made the connection between NTDs and climate change. Now, climate impacts on health. We've calculated that our peer learning to action model could potentially save 7 million lives at a cost of $2 per life. And we're met, when we say this, when we present this, we've had partners say, well, this sounds too good to be true. These are initial calculations. It's modeling. It requires a lot of refinement. But we believe the basic equation is sound, is that if we can connect 100,000 health workers and they each develop and implement local projects with local resources, each local project is responding to climate change impacts on health in some ways, then we are likely to make progress of the kind we've seen with immunization and other disease areas. The difference is, of course, what's at stake with climate change and health. So we asked a group of 1,234 Francophone and Anglophone health workers. We said the first thing they told us is that most of them are part of the family or trusted friend. And then we asked them, climate change is a threat to the health of a community that you serve, and to rate the sort of threat level. And you can see almost half assign the highest threat level. And when we asked similarly, do you worry about change? Most, you have said, gave the highest worry. So from that inaugural event on the 28th of July, 2023, you can see on the left here, we've issued an insights listening and learning report, an eyewitness report with health worker experiences, describing from below, from the community level, how what impacts climate change is having on local communities, being served from the perspective, from the vantage point of health workers. We're also extending, and this is again demonstration of how platform, network, and community provides new capabilities. With a new partner, we're exploring community engagement to sustain malaria action. And the first session for that was at Teach to Reach, with again 21,389 health workers receiving information, with over almost 2,000 contributing, sharing experiences, and thousands in actual attendance on the day of the event itself, with activities before, during, and after Teach to Reach. Malaria is clearly kind of running thread of going concern for health workers themselves, for their own health, for their own families, and of course the health of the communities they serve. So a platform, network, and community that began with immunization is now extending offshoots, branches into other areas that actually matter for local communities. Now, for the International Women's Day, what we did was we invited women in the network to share their messages with their daughters and with other young women aspiring to a career in humanitarian work or global development or health. So 177 of these contributions have now been published into the Women Inspiring Women collection. We invite you to look at it and to share with your daughters or other young women. Now you may say, well, this seems to be all over the place, all these different areas, how are they connected to each other? So we again asked the community, and we had a group of 1,300 participants come together to contribute to the development of what we call the Manifesto for Global Health. This is an open source document. We're at version 2.1. It's constantly being, new contributions are being added, but it describes from the community level, from the vantage point of people who do the life-saving health work every day, what they want from global health and what global health needs to do for them and what they are doing for global health, and looking at the people capabilities in particular. So it's an extremely important document, and it provides that sort of holistic running thread between these different diseases, between these different silos, and connects the dots for global health in very important ways. Now, there's these massive flows of data, millions of data points, experiences, primarily experiential data, but also quantitative data being shared. What happens to all of these? Our first commitment is to give back to the community that originates them. That's our mission, and that's key to the learning process, but it's also key to dignity and respecting the experiences that are shared, and also maintaining the bond of trust that we've worked so hard to earn. So the Knowledge to Action Hub, which we built initially for IA 2030, for Immunization Agenda 2030, is a Knowledge to Action Hub that Teach to Reach is a part of, is one component of, but it also includes sharing the insights, collections, the listening and learning reports, the eyewitness reports, the audio podcasts, the double loop, the sort of rapid knowledge exchange, experience exchange platform. And what we're seeing is we're now able to take thousands of inputs of experiential knowledge, say on HPV vaccination to prevent cervical cancer, and package that, take the experiences of thousands of health workers, package that into a publication, and then go to the national authorities, in this case of 32 countries that are engaging in HPV vaccination campaigns and scaling up or introducing or reintroducing HPV vaccine, and asking them to endorse, validate, and then circulate and disseminate this to their health staff. So that is where we truly close the loop from local experiential knowledge all the way to validation and endorsement by the national authorities. So this is a quick overview of how, through that progression, we've learned to build communities very rapidly. We're also going back to our the very first course issued by the Geneva Learning Foundation. The Digital Scholar Program is a 8-module program really intended to teach you and your organization how to do what we do, and that goes from design to analysis to facilitation to financing to actually leading change, platforms, apprenticeship, and partnership. Thank you for listening. I hope this has been useful, and do let me know if you have comments or feedback.